I was hired by the VA hospital some time ago, and as part of the employment, I have to get screened for tuberculosis. So what's involved in that is first you go through the tuberculin test. And in the tuberculin test, they inject the skin with an antigen, and you wait for about 72 hours to notice whether you have a positive or a negative reaction. A positive reaction will basically involve the development of inflammatory reaction in the area of injection. So when I had to do that test, I told the physician that I'm going to test positive. So he was kind of surprised, wanted to know why I'm going to test positive. Well, I explained to him that I was vaccinated against tuberculosis. Well, the physician didn't know that there was a vaccine actually available against tuberculosis. And so he didn't want to do the x-ray, he wanted to do the tuberculin test first. So I had to do the tuberculin test. Sure enough, after 72 hours, I returned to the clinic. I was tested positive. And the next step, of course, is to take a chest x-ray to rule out any infection with the bacteria that causes the disease, tuberculosis. Now, what's involved in this inflammatory reaction is what is known as delayed type hypersensitivity. And it's type 4. So when we talk about type 4 hypersensitivity, we talk about delayed. And it's delayed because it will take at least 24 hours. And in the case of the tuberculin, it will take about 72 hours before you can evaluate the tuberculin test. Another type or another example of delayed type hypersensitivity is contact dermatitis. And I think most people are familiar with poison ivy. So poison ivy is an example on delayed type hypersensitivity. There are other examples associated with certain metals, certain cosmetics that will cause this type of reaction. Now, what's so different about this reaction is that there are no antibodies involved in the inflammatory reaction here. What is involved in here is T lymphocytes. So when you get exposed to the antigen is going to stimulate these T lymphocytes, and they're going to produce what they call inflammatory mediators or cytokines. And that's part of the inflammatory reaction that will develop as a result of this type of hypersensitivity.